Good day, class. In this video, we are going to continue the discussion on the formulae. In the previous video, we have introduced 麻黄汤 and 桂枝汤. In this video, we are going to introduce 小青龙汤 and 大青龙汤. 小青龙汤, 小 means small. 青 means the color of cyan. 龙 is the dragon. So it means the small cyan dragon. 大青龙汤, 大 means big. 青龙 still the same, the cyan dragon. Why we use dragon in the title of this formula? The dragon is a lucky creature in Chinese literature. Or the power of the dragon is controlling the water. In the legend, it is described as the king of the dragon lived in the eastern sea of China. The capacity of this dragon, it controls the weather, the raining. The big dragon have the power of gathering the clouds and cause raining. The small dragon doesn't have that much power. It only can create the wind, can create the waves in the ocean. As you can see, these are actually the stories that's from the title. If you understand the stories behind the title, you will understand the function of 小青龙汤 and 大青龙汤, the efficacy of these the two formulae, which means the small dragon, the 小青龙汤, can reduce the water because it can cause the waves, the small waves. 大青龙汤 the big dragon can cause raining, can gather the clouds in the nature, can cause raining. So in our human body, it can cause severe sweating. In 麻黄汤, we said after taking the herbal medicine, the patient need to lie in the bed, covered with duvet to cause slightly sweating. After taking 桂枝汤, the patient even need to eat or drink the rice porridge to cover with duvet to cause sweating. Because the efficacy of induce the preparation of 麻黄汤 from 麻黄汤 and 桂枝汤 is not that strong, but from 大青龙汤. As you can see from the name, the big dragon can cause sweating. So after taking 大青龙汤, you don't have to drink the rice porridge, don't have to cover with duvet. The patient may present as sweating. While sweating, through sweating, we can dispel the pathogens. In this situation, the patient may present as fever, and we can use sweating method to reduce the fever. 小青龙汤. The ingredients, when you see from the ingredients of 小青龙汤, 白芍, 干姜, 甘草, 桂枝. This is very similar to 桂枝汤. When you see from the other group, 麻黄, 杏仁. These two are from 麻黄汤. So when you see from the ingredients, you see this formula actually is the combination of 麻黄汤 and 桂枝汤, and then add 半夏. 半夏 can clear the phlegm. 五味子 is sour. It can astringe. It also can be used for cough, to stop coughing. The function of 小青龙汤, releasing the bacteria by expelling the cold. Wound the lung, 麻黄, same as previously, it can be used for wind cold syndrome. In this situation, we will use 桂枝. 桂枝, 麻黄 and 桂枝 mutual reinforcing. 白芍, sour. 杏仁 bitter. 干姜 is the dry ginger. You can warm the middle jaw because of the warmth. It can be used for dispelling the coldness. It can be used either excess cold or deficiency. 半夏 warm and pungent. Dry the dampness to relieve, expel the phlegm. So 半夏 can be used for the combination of dampness and phlegm, especially the cold phlegm. The damp phlegm is the combination of dampness and phlegm. There's also a type of cold phlegm because dampness is in this ingredient is warm. The warm in property can be used for coldness, can reduce the dampness. 味子 sour, sweet, warm. We have introduced the sour can astringe. Astringent lung can relieve coughing. Astringent intestine can stop diarrhea. Can drain the spermatoria. That's astringe from the sour. Sweet and sour can create yin. So from the herbs itself, it can create yin. Can be used for yin deficiency, such as thirsty or yin deficiency. The combination of the whole ingredients, the whole formula, 麻黄 and 桂枝, the dominant herbs, 杏仁 and 甘草, the minister drug, and these three, Juban's drug. So as you can see from the different types here, this is a more comprehensive formula. In this formula, because the dominance, the minister, or Juban, in the acupuncture prescriptions, we also need to determine which points are the dominant points, which are not that dominant, which are the ministered acupoints. The dominant points we need to use for the main symptoms or the chief complaints. In this situation, the patient presents as nausea or vomiting, fever, cough. The patient may present as thirsty or diarrhea or scanty urination or difficult urination. The patient may feel fullness in the abdomen or abdominal distension. The patient may present as tachypnea. The reason for this situation is the patient suffers from exogenous pathogen, the wind cold. After a few days, it is not healed, and in this situation, the patient develop in the water retention in the heart or under the heart. So where is under the heart? That's the water retention in the middle jaw. For this situation, we're going to use, because of the cause, the main cause, still the wind cold attack from the exogenous pathogens. So we can use 麻黄 and 桂枝 as the sovereign drug. We're going to use 杏仁 to relieve the coughing. We use 干姜 to warm the middle jaw. When we warm the middle jaw, you also can relieve nausea. 干姜, the ginger, also has the function treating the nausea or vomiting. So the minister drugs to assist the accompanying symptoms. 银翘散. 银翘散 is another type of the formula. This is not the pungent warm releasing formula. This is the pungent cool releasing formula, which means this formula is used for wind heat. This formula recorded in 温病调变. 温病调变 is the wound disease. It's a monograph that's talk about wound diseases. The wound diseases is also the common disease, the common flu or common cold due to wind heat, as well as pandemic. We also can use this group of formulas to treat, especially the one due to wind heat. The patient may present as fever, aversion to wind cold, nose perspiration, non-smooth sweating. This is a direct translation. What does it mean by non-smooth sweating? In this situation, the patient will present humid or moisture on the skin. The patient may feel sweating. The patient may feel humid on the skin, but doesn't sweat a lot. So this is what we call non-smooth. It is no absence of perspiration. The patient may present slightly perspiration, but not severe perspiration. So in this situation, you may just think about, or you can may just imagine this is the patient. The sweat wants to come out, but it stops somewhere. It doesn't come out the much or the well. That's why we say non-smooth sweating. Headache, thirsty, cough, sore throats. The tongue, a red tip of the tongue. Thin white or thin yellow coating, floating rapid pulse. As you can see the indications, the symptoms of 隐壳散. All symptoms go to the heat symptom, the heat syndrome. Floating pulse, bacteria, rapid is the heat. Red tip, also the heat. Sore throat, also the heat. Thirsty, the heat will consume the water. So the patient may present as thirsty. The first ingredient, 金银花, bitter and sweet. Cold in property. Bitter and sweet and cold can eliminate the fire and toxicity. The fire and toxicity is two are similar but not the same. Toxicity is worse than fire. Pungent can disperse. Fragrant also can disperse. So these herbs can dispel the pathogens in weight level, in qi level. It can dispel pathogens in the upper jaw because it is a kind of flower. When we want to use 金银花 to dispel the pathogens in a weight level, we're going to add 连翘. If you want to dispel the pathogen in qi level, we're going to add 石膏 and 知母. As you can see here, the same herb for different function, we're going to use we can use different minister herbs, or we can use different herbs to assist this function, this herbs to go to perform specific function. Same as acupoints. With one acupoint, point A, if you want to perform one function, you can add point B. If you want to perform the other function, you can use A plus C. So there's something we need to think about. We need to always think about the prescription of your acupoints. In one acupuncture prescription, we don't just prescribe the points randomly. You need to have a very clear mind which point is the dominant, which one you want to use as the minister points. 连翘, bitter, cold, and light. This is also the flower and relieve the wind at weight level. 桔梗, bitter, pungent, neutral. Focus on clearing the phlegm. So when you see the 桔梗, and in the previous slides, we talk about 半夏. 半夏 also can clear the phlegm. One of the most difference between these two herbs, one is clearing phlegm, 桔梗, warm. 桔梗 is neutral, 半夏 is warm. Because it is neutral, so it can be used for coldness and heat, no matter which one. 薄荷, this is the mint. Dry mint, pungent, fragrant, cool. It can be used for dispersing, can activate the liver stagnation. It can be used for dispelling the wind heat. So when we put all together, 金银花、连翘 the Sovereign herb, 薄荷、桔梗、牛蒡子、竹 can be used for sore throats, for specific symptom. 生甘草、芥穗 minister herbs. 淡豆豉 pungent worm. There are two different types of 淡豆豉. One is pungent worm, one is pungent cool. Pungent. The reason for this is the processing method. That's why the processing method is very important. When we process 淡豆豉 with 麻黄 and 树叶, 麻黄 and 树叶, these two are warm. If we change the property of 淡豆豉 into warm, if we process 淡豆豉with 青蒿 and 桑叶, the property of 淡豆豉 will be cool. So that's how we change the property of the specific herb, one of the processing methods. It is described in this below this formula, how to the administration, when to take and how to take. In severe condition, take every 4 hours, 3 times every 4 hours, 3 times during the day, once at night, or even more at night. So every 4 hours. In a mild condition, we can take it twice a day and once at night. So this is an example of the administration of the herbal medicine, how to take and when to take, how many times do we need to take. It will depend on the condition, severe or mild or moderate. 桑菊饮 桑菊饮 and 银翘散 are very similar. The function are very similar. 桑菊饮 is not as strong as 银翘散. 桑菊饮 mostly for cough. So it described in the clause, only cough. The patient doesn't present as a hot sensation in the body. So the fever or mild fever or even no fever, however, this patient presents as cough. 桑叶、菊花 Etu, Sovereign and cool. 杏仁、桔梗 杏仁 we have explained previously. 杏仁 can be used for lung. It is bitter minister drug. 连翘、薄荷 pungent and cool. 芦根 can nourish the yin of the body. Because this patient suffers from wind heat attack, so the heat will consume the body fluid. So we can use 芦根 to relieve the heat. When we compare with 银翘散 and 桑菊饮, 银翘散 expel the bacterial pathogens, relieve fever due to wind heat. 桑菊饮 is more focused on stop coughing. That's why in the clause, in the original clause, it describes the patient presents as coughing only, mild or even without fever. So when a patient presents as fever, turns yellow coughing with yellow phlegm, now you can think about, especially at the first or 2 days, you can think about 银翘散. If a patient presents as coughing only, no fever, or after a few days, still no fever, only coughing, the dominant symptom is coughing. So you can think about 桑菊饮 or modified 桑菊饮. 增液汤 also in the other category, this formula is mainly for yin deficiency, especially for constipation. So it says for Yang Ming Wang disease. What's Yang Ming Wang disease? There's also Yang syndrome due to the heat. The patient doesn't have enough body fluid, so it will result in constipation, thirsty, red, dry tongue, or symptoms indicates the lack of body fluid in the body. So in this situation, it's very similar to the metaphor that we said. In the river, if there's not enough water, the boat's going to sit on the floor. The boat doesn't move. So the boat is the stool. The stool sits in the intestine. So in this situation, we want to increase the body fluids in the body. More specifically, we want to increase the body fluid in the large intestine. So we're going to use 玄参、麦冬、生地. And if we study more on the herbal medicine, although we didn't introduce these herbal medicine, when you see the indications of these herbal medicine, these are actually from reinforcing. So these ingredients can reinforce, can tonify. However, as I mentioned previously, this formula we need to use for constipation. When we use some formula to treat constipation, we need something purging. We want to purge something. We want to cause diarrhea. How can you use tonifying herbs, tonification, to cause purging? Because according to our understanding, purging means we need to reduce. We need to use something can reduce to cause purging. But now, how can we use tonifying herbs to cause purging? So it described in the clause. We need to use large dose, a high dose of these ingredients. Only in this way, you can have enough water, enough body fluids in the large intestine. So if you have enough body fluids in the large intestine, then you can soften the stool, you can cause or relieve diarrhea, relieve constipation, even to cause diarrhea. So this is one of the methods to treat constipation. In this video, we mainly study 3 formulae. From these examples, we need to try to formulate the thinking how to construct a prescription. Although here we use the herbal medicine as the example, we also need to think about how to construct the acupoints according to these principles. I think in the next video, we are going to discuss other formulae in the other categories. Thank you for your attention.